Good afternoon, everyone, and welcome to today's webinar on polarization of alcohol consumption during times of crisis, what we can learn from Ukraine's drinking in 2023 and 2024. My name is Alexandra Olsen, and I'll be guiding you through today's session. This webinar is part of the EU-funded WHO Evidence into Action on Alcohol project, or EvidAction, which works to reduce harms due to alcohol consumption in 30 countries across the European Union, as well as Norway, Iceland, and Ukraine. The project brings together researchers, policymakers, and youth to strengthen responses to alcohol-related harm. And today's session is one example of how we can connect evidence to action on the ground. We're pleased to have participants from across Ukraine and beyond joining us to explore how crises like the COVID-19 pandemic and the ongoing full-scale war can deepen vulnerabilities and change patterns of alcohol consumption in society. Today we'll hear evidence from new national survey data, learn from international and local experts, and discuss practical ways forward to reduce harm, particularly for those at higher risk. A quick practical note for our audiences on Zoom. Please note that you can listen to this broadcast in English or Ukrainian, and everyone can ask questions using the Q&A function. The questions our experts online will try to respond to. With that, I'm honored to invite Dr. Jarno Habicht, WHO representative in Ukraine, to open our discussion today. Jarno, please go ahead.
Thank you, and greetings from Kiev, and good afternoon, good evening, good morning, wherever you are following us, because I know there is a great interest, not only in Europe, but across the world, what we are talking today. So, dear colleagues, partners, and guests, it's really my honor to welcome you today to this webinar. And over the past 2 years, Ukraine has faced extraordinary challenges. There is ongoing war and humanitarian crisis. The resilience of Ukrainian people has been nothing short of remarkable. Yet, as we know from global experience, times of crisis often bring with them not only visible destruction, but both explicit and hidden public health threats, one of which is shifting pattern of alcohol consumption that we are discussing today with many of you, and thank you for shedding light on that topic. WHO, in coordination with Ministry of Health and the Ukraine Public Health Center, has conducted now 2 rounds of national survey to better understand that situation, how alcohol use has evolved during the past 2 years. And the findings are both revealing and concerning as we are looking to this as public health experts. So, not to preempt the meeting, but what we have learned, some highlights, what are important for me when I'm looking to this data. We see that in 2024, nearly 8 in 10 adults in Ukraine reported consuming alcohol in the past year. And more than half of those individuals, namely 57%, were active drinkers, consuming alcohol at least once a month, which is a notable increase from the past year, 2023. And that's a trend we want to discuss today. But even more troubling is the rise of heavy episodic drinkers, now reported over 54% of current drinkers. And this pattern is especially prevalent among men and young adults, with the highest rates seen those aged 18 and 29. And that's an important reflection when we are looking to next generations and human capital. Furthermore, we saw and we see a stark polarization in drinking behaviors, and that's why the name also of the meeting. While a significant portion of population has reduced or stopped drinking, after citing the war as a turning point, others have increased their consumption. So we have a two-way trend at the same time, And some of these trends, especially those who are consuming alcohol, are at dangerous levels. And that divergence reflects not only the personal coping mechanisms, but also broader socioeconomic disparities that we see at the time of war. Individuals from lower financial status are consuming more alcohol on average, and often in riskier patterns, despite being less likely to drink overall. These consequences are real, and we need to discuss how to address them as well. And nearly 15% of current drinkers reported harm to their physical health or their well-being due to the alcohol. 1 in 4 expected guilt, memory issues, difficulties fulfilling daily responsibilities. And the impact extends beyond the individuals. Over 30%, 1 out of 3, of respondents reported growing up with a heavy drinker. And the majority of them, they said it has lasting negative effect to their lives. Again, something that we need to reflect when we look to the future. But despite all these challenges, there is also hope. Public awareness on alcohol-related health risks remains high, and support for stronger alcohol control policies has grown. So we have opportunity to tap to the evidence-based policy options that we can learn from other countries, and what we are discussing also in this network that can help actually to address the harm from alcohol. Nearly 68% of respondents believe that during wartime, additional measures such as limiting sale hours and increasing prices are necessary to protect public health. And I hope that some of those measures can be implemented, but then also carried forward for the further years, as we have seen those policies working in other countries. Today's discussion is beyond the data, and I'm very glad to see so many of you connected. It is about understanding the human stories behind the numbers, identifying the drivers of harmful consumption, and most importantly, exploring evidence-based solutions that can help Ukraine emerge from this crisis healthier and more resilient. Thank you for your commitment, and I look forward many of the good discussions, expert opinions, and it is one of many meetings as we need to address the chronic diseases and non-communicable diseases at the time of war and in the post-war environment. Thank you, dear crew.
Thank you so much, Dr. Habit. That was great. Thank you for the opening remarks and already setting the scene and talking about some of the great work that colleagues in Ukraine in the WHO country office and on the ground are doing in this area in critical conditions as well. I think it's fantastic, and we'll be hearing more about that work also throughout this session. So thank you so much again, Dr. Jarno. Now we'll continue the session by setting a broader context. Our first speaker with us today is Professor Jürgen Remm, a leading expert in alcohol epidemiology and global health. He will share some insights from emergency settings and the COVID-19 pandemic, where we have seen this polarization effect that you will have seen in the title of the webinar, meaning that some people reduce or stop drinking, while others, especially those already vulnerable, may increase risky alcohol use. Jürgen, will you help us understand how these dynamics play out in times of crisis, and why is it important for health systems to anticipate this and to keep up?
Thanks a lot. I'll try to help, but I think we know enough. In March 2020, basically the first month of COVID as we know it in the West, we've already written about that and warned about polarization. So it is not anything which is new to the alcohol field, but it is something where a lot of the decision makers were not aware of. So basically, I will start with that. What is polarization? Basically, you have two groups of people with regard to alcohol. Ones who drink up to a certain level, light, moderate, and ones who are drinking heavily and or have alcohol use disorders. Due to the heavy drinking, the brain of the second group is wired differently. So we are not speaking about something which can be easily, with an information campaign changed. And so what happens in crisis? In crisis, there's stress to people, most people. There may be some billionaires who just go off and go to an island away from the war, but 99% of the people will experience problems. Crisis like COVID-19. A lot of people were very much concerned. The mental health hotlines were ringing. There had to be quite a lot of efforts of society to deal with that. So in times of stress, the majority of people will deal with COVID. They have other problems. They basically forget drinking, and they cannot also drink for some reasons because there was a curfew, there was a lockdown. However, a minority who is drinking heavily before, they cope by drinking more alcohol. And that we have good reasons, as I said, biological reasons. It's the same in rats, it's the same in mice, it's the same in apes. So basically, we know that we have to deal specifically with those people and help them. And those are not only people with heavy drinking patterns, but those are all people who have mental health vulnerabilities. So basically, normal times and crisis. Normal times is very simple. The more a society drinks, the higher the proportion of people with alcohol use disorder. So if we reduce consumption in society, we will have less people with alcohol use disorders. In times of crisis, no. We reduce the population drinking, but we increase in a certain group. And I've tried to make that in a pictogram. So basically you have those who had been drinking before, they increase, some stay the same, and the rest decreases. So a very atypical pattern, which is only in times of crisis. And COVID-19 was such a crisis. So basically, that was theory. That was theory based on experimental studies, based on some natural disasters. We had natural disasters, by the way, for humans are also big-time recessions. If suddenly 25% got unemployed, that is a crisis. That is a problem. So we have good evidence from those kinds of times, and we have good evidence from pandemics, epidemics. And they all pointed into one direction, that we have to realize in times of crisis is not the time to cut down on mental health and addiction services. Basically, that is exactly the opposite time. And because we are empirical scientists, we always study it anew. So in COVID-19, we did surveys and we did a meta-analysis of all studies in Europe who were concerned with drinking before and after. That would be all studies which have at least two measurement points, one before COVID and one during COVID, and then we could measure how people behave. And people behaved exactly as predicted. So those who were light drinkers sometimes stopped drinking during COVID or during times of lockdown, but overall they stopped. And in Europe, alone in the first year, it was a 10% reduction of alcohol consumption for all of the EU countries combined. But those people who had pretty heavy drinking patterns before, who experienced some problems with drinking before, and who did have some mental health stress, they used alcohol to cope with this problem. Unfortunately, it was an attempt to cope because alcohol doesn't solve the problems. And so we have this polarization. The majority goes down, some people get into problems, and that is what the healthcare system should realize and should actually react to. So this is just the curve of what happened in the EU during COVID-19. This is based on studies with several thousand people in more than 20 countries of the EU, and the evidence is pretty solid. By the way, humans are humans, and the same is true for Canada and the US and whatsoever. So it is a clear sign. Then, what happened? Well, we asked health ministers, did you do anything? We asked the governments, did you do anything? But governments said, oh, we have to help poor alcohol industry. They sell less alcohol. So we allowed alcohol sales via the internet. Those countries who had loosened these alcohol policies, for example, some states in the US, we've just written an article about that, they actually increased their consumption. The few, overall, most countries did not, but they tried. And so instead of doing something to help people with problems, the major reaction was, during kinds of COVID, it's so much stress for the industry, and we have to help them. So that was the predominant reaction. So what happened in Europe because of that? Because alcohol was still kept more available than it should be. Basically, what happened is that a lot of people died more for alcohol, 100% alcohol conditions, like alcohol poisoning, what was called alcoholic liver disease. It is liver cirrhosis mainly. The correct term now is alcohol-related liver cirrhosis. And those countries who had the most bingy drinking styles, they died way more. So you see here a very flat line. Before COVID, overall in the EU, it went down a little. After the year 2019, the year 2020-21, it increased in all EU countries by about 6 to 8%. And those countries that had a very bingy drinking pattern, like the Baltics, they increased partly by 50%. So that is something which very clearly should have resulted in opening more treatment places, especially in those countries. So what is my overall conclusions? The overall conclusions is there's times of crisis. Realistically and normally, people would deal with those crises, but they deal with the immediate stuff. In COVID, they dealt with COVID problems. They dealt with COVID, and they forgot that on the backlash, we have all of those mental problems, and we would have to open some more treatment for alcohol, alcoholic liver cirrhosis, etc. Because now, during COVID and afterwards, we experience all those problems, but those problems could have been foreseen, and we do have some ways to treat and act in this situation even virtually. We do have virtual kind of interventions. So overall is whenever there is an upcoming epidemic, and as soon as you know there is something really big coming or a big recession coming, that is not falling from the sky. You have months to react. Please think about people who experience stress and who use alcohol and other devices, drugs for example, to cope with this stress and to actually get worse. Thanks a lot.
Thank you so much, Jürgen. I think that was fascinating. I think what's stands out is that this is one of the cases where the theory and the practice, they match so well. So what you had in the theoretical, we could see very easily during COVID-19. You also mentioned some of other crisis situations, that these are not just pandemics and wars, but can also be economic recessions. I wonder if you have any examples of countries that did well, that either adapted or that provided services, anything that you've met where this was a good practice?
Real good practice, no.
Okay.
During COVID, it seemed to be that in terms of the coping of the healthcare system with COVID, there were a lot of mistakes done. Even countries who usually rank very high in their health services actually forgot those kind of practices. I've seen, however, that Spain has reacted quicker than others to actually start telephone services, to alert their units, to treat people, to actually preview an increase in treatment, and to some of those agencies, it's also very regional, like Catalonia, they gave out and said, look, you will see people who are coming in now, they actually drink even higher than they drank before. So you measure certain measures biologically, like the gamma GT value, etc. So there were some reactions who were less worse than others.
Okay, and I guess that's some good lessons learned, right? I mean,
I'm sorry, I don't think we should go there, but
Yeah.
we had lessons, after SARS. All the countries who were affected by SARS said, we have learned our lessons. We are now prepared. We have everything done. When the COVID-19 pandemic, and Canada was one of them, where I live. So Canada said, we are now fit for any pandemic. And a few years later, COVID, they went to all those stores where they had all of their masks, etc. They were all already defunct, and they had to start from anew. So I hope that there will be enough memory collectively that we prepare better in the future, but I'm not so sure it will happen.
Okay, thanks a lot, Jürgen, and thanks for your opinion. I think that is what's tricky with emergencies and crisis, is that there are these elements of preparedness and then there's response, and sometimes these crises hit so unexpectedly that response is the first priority. And I think that's a good bridge for us to move on to what the situation looks like in Ukraine. And for this, we're pleased to welcome Andriy Skipalski, a technical officer and unit lead for non-communicable diseases at the WHO country office in Ukraine. Andriy will share the latest national data on alcohol consumption during the full-scale war collected in 2023 and 2024. Dr. Jarno at the beginning already summarized some of this data, but I think Andriy will unpack it for us, and this will include the emerging trends, risk patterns, and what they may mean for the response. Let's see if the information that Andriy gives us gives an indication of how well prepared Ukraine is also. Andriy, please go ahead.
Alexandra, colleagues, partners, good afternoon. It's a pleasure for me to be able to speak at today's webinar and present the work of the joint work of WHO Country Office and WHO Regional Office for Europe, but also of my colleagues and stakeholders in the ministries and public health center. On behalf of the Ministry of Health, as passed to me that, from Dr. Kuzin, Deputy Minister, who couldn't say the opening words, it's just the assurance that for Ministry of Health, the alcohol control and measures are now one of the priorities, and it is backed up with some of the policy development which is going on now. About the what I'm gonna talk with you today, if I will present the comparison of two rounds of studies of alcohol consumption for adults in Ukraine in 2003 and 2004. Next slide, please. Or should I? Okay. This is a representative telephone survey. We used adopted EU standardized questionnaire, which was a challenge to use for the first time, but for the second, it is gradually, or it might be recommended to be used in Ukrainian setting in future. But this is very important to pilot this questionnaire and to be able to evaluate not only the frequency and prevalence, but also the amount of alcohol consumed by population. Next slide, please. Yeah, what is the overall picture? We don't see any considerable changes among 2 years, but at the same time, you can see that nearly 80% of population refer themselves as current drinkers, and 11% are abstainees, or another 11% have never consumed alcohol. So this situation hasn't changed a lot, but the next slide actually will reveal what I would like to tell about polarization. Next slide, please. At the same time, the number, as we remember, number of people who are current drinkers did not increase. The proportion of current drinkers, those who declared that they drank during their last 30 days, increased by nearly 12% comparatively from 2023 to 2024. And at the same time, you can see the alarming increase in heavy episodic drinking from 49% to 54%, which is another 10% increase in heavy episodic drinking prevalence. We don't see the consumption alcohol per year of ethanol per person has increased. It's even decreased a little bit, but the frequency of episodes in general increased as well by 10%. Next slide, please. Of course, it's expectedly there is a huge difference in alcohol consumption by gender. At the same time, there's a striking difference. We can see that men consume alcohol 5 times more frequent than women. And it refers to all daily, weekly, monthly, and less. But it's 5 times more than women. In the age groups, there is no considerable difference, but we will see the difference in the other slide. Next slide, please. It's, I have mentioned that it is 5 times more frequent, but it's also nearly 5 times more alcohol per person per 1 episode of drinking as declared by the respondents. You can see that on average, per 1 drink, Ukrainians consume nearly little bit more than 7 grams of pure alcohol. But for men and women, it's 5 times difference. You see 12.4 versus 2.5 grams of pure alcohol. Next slide, please. Yes, and this is the reference slide that we used, specifically these measurements that we discussed with regional office, how to identify the heavy episodic drinking and how to actually communicate one standard drink to the population while assessing their drinking habits and drinking patterns. Next slide, please. Okay, heavy episodic drinking. Aside of the frequency of alcohol consuming and the huge difference in disparity between men and women, we also see the increase in heavy episodic drinking. It's nearly it's nearly by 10% compared with 2023. So 55% of current drinking declared that they have at least one episode of heavy episodic drinking, and of course, men nearly twice as often compared to women. At the same time, the highest prevalence of high episodic drinking was identified in the age group of male population of 18-29, who reported 67% of episodes during the last prevalence of 67% among this group. Of course, another disparity and another polarization is of heavy episodic drinking being more prevalent among people with low financial well-being. They declared as much as 74 episodes per year compared with the 22 episodes of the financially stable drinkers in that group. So it's nearly more than twice different between the socioeconomic groups, and it's also describes the drinking pattern, current drinking pattern in Ukraine. Next slide, please. So in alcohol consumption, there is no any surprise here. It's the even consumption of beer, wine, and spirits groups. But expectedly, the spirits are the largest, present the largest part in pure alcohol consumption. In grams, you can see that nearly twice as much as compared to the other groups of alcohol drinks. Next slide, please. Yeah, and what proves the findings is that Ukrainians prefer to consume alcohol at home or at somebody else's home, but only 15 to 17% of population, without no difference between years, drink alcohol in pub, clubs, restaurants, where you can little bit be restricted by prices or by other policies. So because there is a curfew and restaurants and bars usually close at 10 or even earlier, we can see this pattern hasn't changed, and maybe this is the reason why it may contribute to the heavy episodic drinking increase and prevalence in Ukrainian population. Next slide, please. Yes, unrecorded alcohol. So with unrecorded alcohol, it hasn't changed. I think it's more than 42 declared that they drink some type of it is nearly 50% of unrecorded alcohol, but 42%, 43% was homemade alcoholic beverages, and this situation is also needs to be addressed from the authorities. Next slide, please. And now feeling the consequences, as Jürgens mentioned a lot, the links between the mental health status, etc. So Ukrainians feel the consequences of the alcohol consumption. We can see various figures. There is no quite a big change between years, but feeling guilty, feeling guilty and fail to normally perform in the normal life. It's between 20% to 7%. At the same time, nearly 3.5% may qualify for some addiction to alcohol because they feel like they need to drink in the very morning every day. Next slide, please. Yes, and we can see here that how many Ukrainians consider they have the household member or the close relative, ex-spouse or ex-partner as who may be qualified as the heavy drinker. So it's about 4%. This figure hasn't changed, and 10% for the other household members. But in the working environment, in other social environment, this percentage is huge. It's up to 1/3 of the population consider and they know someone who can be qualified as hard drinker. Next slide, please. Yes, and we can see for those who mentioned they have or they may live in one household with a household member who is hard drinker, the significance and the negative impact on their life increased a lot, from 70% to 85%. It corresponds with the data that heavy episodic drinking prevalence increased, and that affects those families who live with such drinkers and feel much worse comparatively with 2023. Next slide, please. As my colleagues, next please. As my colleagues mentioned before, so the overall awareness of Ukrainians about alcohol consequences and the consequences for health is extremely high. So you can see as high as 92% of Ukrainians consider that as consumption of alcohol may cause various mental and behavioral disorders, and then traumatism, transport and cardiovascular disease, etc. Only a little bit more than 50% believe it is linked with cancer. At the same time, you can see that overall the respondents marked positively about respiratory disease, which was a control question just to test their attentiveness. Next slide, please. So I'm here with the conclusions. So we can see that when we talk about polarization during crisis here in Ukraine, having the facts that the men consistently, so I'll put it another way. So the drinking, while the Ukrainians don't declare that drink more frequent, they drink more harder. That's put it in this way. Gender gaps persist and they widen, and this is quite an evidence in this survey. And there is some risks for youth because we see young people as declaring heavy episodic drinking a lot, and the frequency of general drinking also a lot. There is a risky pattern for financially vulnerable. They declared heavy episodic drinking as much as twice more than comparatively with the financially well-being group. Unrecorded alcohol is a problem. Health consequences, of course, well known, but needs to be addressed. And support of the regulations, I skipped this slide, but there is a quite high support, about 75% for stronger regulations for alcohol during wartime, but in 2024, it has declined a bit. And as I said, public awareness is high, but actions are needed. Next slide, please. One more, click. Yeah, and one more. Yeah, I think there was a recommendation to refer to this great paper, a very fresh one about WHO quick buys. And there is evaluation of various alcohol control policies and their immediate direction. And we can see tax increase, enforcement of bans and restrictions of exposure to advertising, and as well as physical restriction, the physical availability have immediate effect per se after the regulations are introduced and enforced. Thank you. Thank you, colleagues.
Thank you so much, dear Andrei. Thank you for presenting all of the data, which I think gives us a lot of insights and definitely shows some changes in the consumption patterns, some things that are different in the past 2 years during the full-scale war. Can you tell me a little bit, Andrei, about this survey? Is it a regular survey? Is it one of many that are conducted on alcohol in Ukraine? Can you give me some context on this?
This particular instrument was developed and first launched as part of Avid Action project in 2023. Then we were looking for some type of instrument together with Public Health Center, which may be used in future. And this instrument, of course, we wanted to call it a standardized one. We have such instruments in tobacco control, for example, as global adult tobacco control, global youth tobacco control. But in alcohol, we use this EU questionnaire and adopted it to the telephone-based interview instruments. We had only 2 rounds of survey, and in future it depends on the funding. It's quite affordable instrument. We may have the next rounds this year or next year, or our partners, Ministry of Health, Public Health Center, may use it as part of their surveillance per se. But we would like to have this instrument as one that also would allow us to compare with years.
Great, thank you so much, Andrei. I think that's very interesting, and that this tool actually gives you, I think, a lot of insights, both for the Public Health Center and for the country office. So I think that's fantastic, and glad to hear that. You presented a lot of data. Maybe you can tell us just what stood out for you as some of the comparative data between 2023 and 2024. What would you spotlight, any of the findings there?
Well, I think the first time when we received the data, it was quite perceived positively, because one of the measurements, standardized measurement, it's also the frequency of alcohol consumption, heavy episodic drinking, but also the amount of alcohol that people consume, and this is very important to know. So in these terms, Ukrainians consume quite a moderate amount compared to the officially declared even by WHO. It's nearly 8 liters per year. So in this, when we recalculated, it was about a little bit more than 3 liters a year. But I think this is one of the drawbacks of this survey, as Ukrainians may be very much confused about assessing or evaluating how much specifically they drink in terms of portions, in terms of standardized drinks, and etc. But that was the positive. And the overall consumption pattern, where spirits are not prevalent, also was quite positive for us as spirits attribute to pure ethanol consumption, pure ethanol the most. At the same time, when we talk about 2 years, I already mentioned that Ukrainians for the current drinkers, it stayed the same, but for regular drinkers, those who declared that they drank during the last months, it intensified, increased, and the specifically heavy episodic drinks increased. As Jürgen said, that we may expect the cohort of people, so for one portion of the population drink less, but there would be one small portion of population that would increase their drinking, and it would increase probably the alcohol related disorders, and that would require a more attention and proper addressing by healthcare system. And this is a big concern. And the other, that we don't know how the defense sector here is present, and probably it's not present, and we need to be ready that in the coming years, and the government and this health system should be ready to properly address through mental health strategies, tactics, and through the health services in general, the probability of many people having alcohol use disorders and the affordability of services for them. So that's the thing that I would like to highlight here. For the other tendencies, they were obvious. There is certain polarization, but at the same time, the awareness is very high, support for regulatory measures high, and there is a quite cohort that is decreasing alcohol consumption in the population as one of the coping strategies was during wartime and crisis time. Thank you.
Thank you so much, Andrei. This sets us up, I think, very well for the next part of our session, a discussion on how we as practitioners, researchers, and communities can respond to the diverging patterns in practice. Please keep asking your questions on Zoom. Andrei and Jürgen will also join the experts who will be answering some of your questions online. And now I'm pleased to welcome our first panelists. We'll start by looking at what Ukraine has been doing on alcohol despite the critical conditions. For this, I'm pleased to welcome our panelists, Yulia Chumak, General Hygiene Doctor in the Prevention of Non-Communicable Diseases Department at the Public Health Center of Ukraine, and Valeria Hrtsenko, Chief Specialist in the Management of Control of Viral Hepatitis and Opioid Dependence in the Department of Management and Control of Viral Hepatitis and Opioid Dependence at the Public Health Center of Ukraine. Welcome, Yulia and Valeria. Great to have you here. I will start by asking a question to Yulia. Yulia, can you tell us how has the war impacted interventions to prevent and reduce alcohol consumption in Ukraine?
Дякую. Добрий день усім. Передусім хотілося б відмітити, що ефективні заходи щодо скорочення споживання алкогольних напоїв потребують комплексного міжсекторального підходу із залученням багатьох зацікавлених сторін. Зокрема, це можуть бути і центральні, і місцеві органи виконавчої влади, урядові організації, фіскальні та правоохоронні органи, а також громадські організації. І впровадження таких заходів потребує формування державної політики щодо зниження шкідливого впливу алкоголю, а також змін у поведінкових і соціальних нормах. Отже, до таких заходів, основних перспективних заходів можна віднести це і підвищення ставок акцизного податку та мінімальних роздрібних цін на алкогольні напої, Заборона усіх видів реклами та стимулювання продажу, а також спонсорства алкогольних напоїв. І це також стосується і онлайн-середовища. І збільшення мінімального віку продажу алкогольних напоїв до 21 року. Наразі цей вік становить 18 років. Також ефективними заходами є обмеження фізичного доступу до алкогольних напоїв у роздрібній мережі шляхом скорочення годин або днів продажу. І посилення відповідальності водіїв за керування транспортними засобами у стані алкогольного сп'яніння. Власне кажучи, перераховані заходи визначені Всесвітньою організацією охорони здоров'я та відносяться до переліку економічних заходів Best Buys, і вони є спрямованими на боротьбу з неінфекційними захворюваннями. Також хотіла би підкреслити важливість впровадження обов'язкового маркування алкогольних напоїв, яке б надавало інформацію для населення про шкоду для здоров'я внаслідок споживання алкогольних напоїв, а також про їх поживну цінність. Такі інформаційні повідомлення можуть містити інформацію як про загальний шкідливий вплив алкогольних напоїв, про ризики виникнення, зокрема, серцево-судинних захворювань, онкологічних захворювань, а також повідомляти про заборону вживання алкогольних напоїв вразливими групами населення, як то діти або вагітні жінки. Крім цього, не можу не сказати про такий актуальний напрямок діяльності в сфері профілактики споживання алкогольних напоїв, як інформаційна, роз'яснювальна та просвітницька діяльність. І прикладами такої роботи може бути як, власне, роз'яснювальна робота, розробка та розповсюдження інформаційно-просвітницьких матеріалів, проведення інформкампаній, які спрямовані на підвищення рівня обізнаності про небезпеки, пов'язані з вживанням алкогольних напоїв. І такі заходи мають бути розраховані на різні цільові аудиторії, як то загальне населення, так і передусім важливо їх спрямовувати і на вразливі групи населення. Зокрема, за цим напрямком діяльності є важливою співпраця з медичними працівниками, зокрема первинної ланки. Наприклад, було розроблено інформаційні матеріали, ліфлети, які містять інформацію про те, як же, власне, алкоголь впливає на організм, та містять тести для виявлення небезпечного або шкідливого споживання алкоголю. Передбачено, що такі матеріали розповсюджуватимуться для лікарів, які надають первинну медичну допомогу, які, в свою чергу, будуть використовувати для подальшого консультування пацієнтів. І також ще б хотіла звернути увагу на такому аспекті, як вживання алкоголю вагітними і профілактика фетально-алкогольного спектру порушень. Для підвищення обізнаності та настороги лікарів з цього питання розроблено курс дистанційного навчання та проведено онлайн-тренінг щодо мотиваційного консультування як ефективного інструмента для зменшення вживання алкоголю вагітними. Також розроблено інформаційні матеріали безпосередньо для вагітних, які інформують про шкідливу дію алкоголю та про фетально-алкогольний спектр порушень. Ще одним актуальним напрямком просвітницької діяльності є співпраця з органами освіти. І прикладами такої співпраці може бути розроблення матеріалів для усіх учасників освітнього процесу. Це і для педагогів, і для батьків, і, звісно ж, для учнів, і з питань, що стосуються профілактики вживання алкоголю. І також інтеграція таких питань до курсів безперервного професійного розвитку медичних працівників закладів освіти та, власне, педагогічних працівників. Також хотіла би зазначити, що на сьогодні заходи, які спрямовані на зменшення шкідливого впливу алкоголю, визначені національним планом заходів щодо неінфекційних захворювань для досягнення глобальних цілей сталого розвитку та стратегією розвитку системи охорони здоров'я, які затверджені урядом. Також хочу уточнити, що операційним планом заходів до стратегії передбачено, що протягом цього року буде затвердження план заходів щодо скорочення споживання алкогольних напоїв та мінімізації шкоди через посилення системи державного контролю, профілактики та реагування на наслідки. І цей документ дозволить визначити та систематизувати завдання та заходи, які сприятимуть зменшенню шкідливого впливу алкоголю на населення. Таким чином, комплексне і послідовне виконання перерахованих заходів потенційно сприятиме зниженню вживання алкоголю та зменшенню його шкоди. Дякую.
Thank you so much, Yulia. I think it's so encouraging to hear the work that Ukraine is doing with the WHO best buys or quick buys. I think that is fantastic. And at the same time, the other initiatives that you talked about in terms of raising awareness for the harms of alcohol. And we can see from the survey that Andrew presented that awareness is high and rising as well, but also in terms of the educational and other initiatives that you mentioned there. So thank you so much for presenting this. I think it's very interesting. I'd like to ask a question to Valeria now. Valeria, Ukraine is an example of a European member state that does dual track approach, replying or responding to the crisis, while at the same time reforming the healthcare system. If I understand correctly, there are significant efforts underway, for example, to reform the treatment system for substance use disorders. Can you share some insights about the activities that are going on there?
Доброго дня, дякую за питання. Єдине в мене уточнення, тому що в мене переклад, мова йде про саме психоактивні речовини, тобто наркотики і алкоголь, так?
Yes, exactly. Psychoactive substances, including alcohol.
Дякую за запитання. Власне, якщо говорити про реформу, і з огляду на роль Центру громадського здоров'я, в першу чергу я би хотіла зазначити, що починаючи з минулого року, Україна, Центр громадського здоров'я, Міністерство охорони здоров'я вирішили піти шляхом такої розбудови сервісів і розбудови моделі послуг людям, які вживають психоактивні речовини, включно з алкоголем. Центром громадського здоров'я, власне, була розроблена концепція розвитку таких послуг. Вона була представлена і затверджена колегією Міністерства охорони здоров'я. І, власне, поступово ми рухаємося до того, щоб ця концепція і ми могли її втілити, власне, в життя. Якщо говорити про частини цієї концепції, з чого вона складається, то це в першу чергу тут варто зазначити про стандартизацію медичної допомоги, оскільки, власне, стандартизація медичної допомоги, вона дозволяє отримати такий рівний доступ до доказових інтервенцій, до доказового лікування. А в контексті саме алкоголю, власне, в цьому році робоча група, створена Міністерством охорони здоров'я, розробила стандарт медичної допомоги, психічні та поведінкові розлади внаслідок вживання алкоголю. Можна сказати, що це такий перший документ, оскільки, власне, застарілі протоколи, які діяли в Україні, вони були відмінені, і фактично протягом певного періоду лікарі не мали, скажімо так, доказових документів, на основі яких можна було би здійснювати лікування. І, власне, цю прогалину підтверджують результати, які ми отримали внаслідок оцінки за підтримки ВООЗу, яку ми також реалізовували в цьому році. Це була оцінка спроможності системи охорони здоров'я, зокрема закладів охорони здоров'я, надавати послуги пацієнтам з розладами внаслідок вживання алкоголю. А на сьогоднішній день ця оцінка ще не фіналізована і не опублікована, однак за попередніми результатами ми побачили, власне, деякі такі невтішні аспекти, зокрема те, що, наприклад, прийняття клінічних рішень, переважна більшість респондентів в рамках цього дослідження, в рамках цієї оцінки відповіли, що вони ґрунтуються на власному досвіді або колективному досвіді. При цьому там використання, і при цьому використовуючи також на практиці застарілі протоколи лікування. І крім того, Ми також підтвердили, власне, те, що в нас медична допомога в першу чергу сконцентрована на лікуванні гострих станів, і не надається, скажімо, така комплексна, немає комплексного підходу до вирішення даної проблеми. Тому, власне, якщо говорити про стандартизацію медичної допомоги, про стандарт можна говорити довго, але загалом значна частина в цьому стандарті також відводиться ранньому скринінгу, ранньому виявленню. І тут ми говоримо не лише про сімейних лікарів, про лікарів первинної медико-санітарної допомоги, але і раннє виявлення за допомогою, скажімо так, індикаторних станів, і це в першу чергу ми говоримо про лікарів екстреної медичної допомоги або лікарів спеціалізованої медичної допомоги, куди можуть потрапляти наші пацієнти, а також установи соціального захисту або ранній скринінг на робочому місці. І, власне, коли ми говоримо про інструменти скринінгу, то це ми говоримо про аудит, і відповідно стандартом також передбачена така значна частина відводиться проведенню таких рекомендованих втручань на основі балів аудит. Тут в першу чергу ми говоримо про просвітництво і надання коротких інтервенцій, направлених в першу чергу на відмову або скорочення рівня вживання алкоголю, якщо говорити в контексті стратегії зменшення шкоди. Власне, про реформування можна говорити дуже довго, тому що наша концепція складається з багатьох етапів. Частина розбудови сервісів – це таке доволі комплексне питання. Я зараз, мабуть, не встигну його зачепити, але якщо підсумовувати, власне, питання стандартизації, то можна сказати, що нас чекає доволі багато роботи на етапі навчання медичних працівників новим стандартам та подекуди роботи зі зміною мислення в професійної спільноті. Це якщо ми говоримо про впровадження стратегії зменшення шкоди і, звісно ж, питання розбудови сервісів і доступу до медичної допомоги людям з розладами внаслідок вживання алкоголю. Дякую.
Thank you so much, Valeria. I think that was really great to hear about that and to understand the efforts in standardizations that you are doing. I could also definitely speak for a much longer time about the aspects of screening and brief interventions and the use of audit and also the elements of changing attitudes on alcohol through healthcare systems. But we will have to, unfortunately, move on in our panel today. But thank you both for joining us today and for being with us here from the Public Health Center in Ukraine. Thank you so much. And we'll now be looking at mental health and alcohol use during crisis. And I'm pleased to welcome online Jason Maurer, consultant for mental health at the WHO Regional Office for Europe, and Alisa Ladik-Brezhalova, excuse me if I pronounce that wrong, Technical Officer for Mental Health at the WHO Country Office in Ukraine. I'll start by asking a question to Jason. Jason, in times of crisis, whether it's war, displacement, or pandemics, mental health challenges increase, and people can turn to various coping mechanisms that can include alcohol use. From your perspective as from mental health expert, how can we better understand this relationship between crisis, mental distress, and substance use? And are there any things you would like to highlight in this perspective?
Yes, thank you so much, Alexandra. As you said, emergencies, especially war and armed conflict, are devastating to mental health. There's an estimate from a 2019 paper of ours that about 1 in 5 people in a post-conflict setting that had a conflict in the last 10 years will have depression, anxiety disorder, post-traumatic stress disorder, bipolar disorder, or schizophrenia. And that's anybody, and then 1 in 10 people will have moderate or severe versions of those disorders. Now, those numbers do not take into account alcohol use disorders or other substance use disorders. The data on that is tricky, but by some estimates, about 13% of people who have experienced organized violence or war will have a lifetime diagnosis of alcohol use disorder. So that's about 1 to 7 to 1 to 8 to 1 in 7 to 1 in 8 people. And that's compared to about 4% of people who have not experienced these crises. So it's very clear that in the aftermath, as well as in the ongoing period of a crisis like a war, mental health is in dire need of support. When it comes to specific conditions, PTSD, so post-traumatic stress disorder, tends to be most associated with substance use and alcohol use disorder. There are some estimates that about 30 to 60% of people with a substance use disorder also have comorbid PTSD. And people who have substance use disorders, including alcohol use disorder, also tend to suffer from more severe PTSD symptoms. So there's a high level of comorbidity there that is quite concerning. As a coping mechanism, alcohol use is not very good. It's not very effective in alleviating symptoms of mental distress. And it also has a whole other bunch of associations that is that can be detrimental to well-being and mental health in the long term. It promotes risky behavior. It can make it more likely to for people who have engaged in excessive use to engage in violence, neglect of children, or other basic threats to protection and safety. It can, to some extent, alleviate symptoms briefly, but in the end, this does not last, and it can even lead to feelings of shame, regret, which in the end can promote worsening mental health and well-being. And finally, it leads to dependence and disorder in a small percentage of people, and that is what we are aiming to prevent. From a response and recovery perspective, in the aftermath and ongoing period after conflict, it's also, it can be detrimental to the recovery of communities by taking away resources such as money from families that will then spend this on alcohol, which is problematic. So a key aspect of reducing alcohol use is, among what has been said today already, is also promoting access to mental health services and mental health care. And that is not just formal access through formalized specialized services, but also through primary healthcare services, because those tend to be less stigmatizing. As in many countries, mental health conditions and people with mental health conditions are still highly stigmatized. So providing services that are not specifically focused on just mental health can be a way for people who have reservations about revealing the fact that they struggle with their mental health to go and seek out services in that way. So there are a variety of ways that we can promote the access to services, whether they be primary healthcare, specialized healthcare, or even more informal community-based supports that can provide alternatives to the use of alcohol as a coping mechanism.
So much, Jason. I think that was a really great overview of what actually happens, what we can see in the data, and what is important to take into account when preparing and responding to crisis. Alisa, based on your experience working as a mental health expert locally during the ongoing war, what kinds of insights can you share with us on some of the existing coping strategies among different groups, especially in terms of stress, trauma, and alcohol use? Are there any trends or challenges, and are people seeking or avoiding to seek help for this?
Thank you so much. It was very interesting to follow the discussion so far, and we hear about science, we hear about trends in data, about regulation, about links with mental health. So I will focus briefly on the services angle. And provide a brief overview of the initiative that Ukraine is implementing with support of WHO around its MHCAP program. MHCAP is a mental health gap action program, which aims to fill the gaps in mental health care provision. And in Ukraine, the popular tool is a clinical intervention guide for clinical management of mental, neurological, and substance use conditions. So as you can assume that one of the modules of this clinical decision-making and management tool is substance use conditions. So when we discussed today that about the trends and the drinking patterns that Ukrainians show currently, these people may visit primary health care, first of all, as the entry point to the healthcare system. And we know that Ukrainians trust the primary healthcare doctor. So when they visit the service, they may not necessarily having complaints related to their substance use or alcohol use, but having other complaints related to health or general health or mental health. Then therefore it is essential that primary healthcare doctors and nurses, they trained to recognize the symptoms, the early signs, and provide care to person, but also prevent further development of this condition and probably prevent development of the substance use disorder. Through the MHCAP protocol in Ukraine, doctors and nurses in the teams, they are trained to recognize does the person use substances, including alcohol? Is this useful? Is harmful? Is dependence is likely? And then based on that, the algorithms suggest that they follow certain management protocol. In brief, the management includes psychosocial part of interventions and pharmacological interventions. And then the psychosocial in brief include, of course, starting from psychoeducation, then it is motivational interviewing, then strategies for reducing or stopping the use of alcohol, in engagement of family or linking person with peer support groups and other interventions. And then when it comes to pharmacotherapy, there are a few conditions within the alcohol use conditions that doctors and nurses are trained to provide help with. It is withdrawal conditions. It is how to medicines to prevent relapse in alcohol dependence and few other conditions. So with that, overall, starting in 2019, we managed to train over 7,000 primary healthcare doctors and nurses working in primary healthcare in that MHCAP protocol, and over 18,000 passed online training course. And with the initiative of the First Lady Elena Zelenska and introduced All Ukrainian Mental Health Program in 2022, the new package was introduced in primary health care, which is based on MHCAP protocol, and thanks that we have now increasing the numbers of people with substance use conditions and alcohol conditions who received care in primary health care. Basically, we have in 2022 we had 4,000 people recorded through NHSU data as those who received help in primary health care through MHCAP protocol. And then this number is increasing by 1,000 people every year. This is, of course, just the beginning. And these numbers are not probably reflecting the size of the needs in Ukraine, but the message here that we continue and we need to scale up together with partners to make to ensure service coverage for these conditions. Thank you, and over to you.
Alisa, I think that's very encouraging to hear, and as you say, it's the start. So thank you so much for Jason and Alisa. And we've heard about the patterns now, the statistics and policies surrounding alcohol use during crisis. But behind every number is a person. So we'd now like to share a short film of a woman who has experienced alcohol use disorder. Tatiana's story is particularly powerful because she realized the extent of her problem during the COVID-19 pandemic, when many around her had stopped drinking, but she continued. This moment of awareness became her first step towards recovery. This film is part of the Redefine Alcohol campaign of the Evid Action Project, which aims to shine a light on some of the less talked about aspects of alcohol and harm, including stigma, mental health, and the role of trauma and crisis, and then most importantly, the benefits of reducing alcohol consumption. Tatiana's story reminds us why comprehensive support, understanding, and public health action matter, not just in theory, but in real lives.
15 жовтня я вже знала, що більше не буду пити. Останні 18 років алкоголь був постійним супутником у моєму житті. Але цього разу, завершуючи свій 41-й марафон, я святкуватиму по-новому. Перше, без алкоголю. Цього разу алкоголь не буде частиною мого постмарафонського свята.
Going sober is not something you just do. It takes a lot of thought processing and it's very challenging since the alcohol is everywhere, from airports to stadiums, and it's very difficult to avoid. Living a sober life means that I need to plan a lot of things beforehand. I need to constantly remind myself that alcohol is not a part of my life anymore.
Коли я працювала журналістом в Україні, алкоголь був частиною повсякденного життя. На світських вечірках, або під час прес-поїздок, або просто коли я поверталась додому, то я відчувала, що заслуговую на те, щоб розслабитись, відпочити і випити.
The first red flag came then the COVID hit. We were forced to stay at home and all the social activities and travels stopped. But I didn't stop drinking, even though I was at home alone almost all of the time. Every morning I woke up with hangovers and said to myself, I have to quit. And every evening I started doing all over again. However, social support have been a key factor for me in going sober. First, my decision to tell a friend about my addiction, then publicly coming out, helped me a lot. Surprisingly, I've met lots of support and people were really impressed of my choice. You think your life will change drastically when you become sober, but it wasn't true in my case. For example, I didn't lose weight, I didn't become rich, and honestly, all of my problems stayed around. But it's the small things that change and they add up. I feel the biggest change in my mental health and confidence. My mood and my self-esteem have gotten a boost and I sleep better. My mother, of course, keeps saying that I look differently, more fresh and glowy, and I see changes, of course, every day more and more often.
Алкоголь – це дуже часто спосіб приховати свої страхи. Я боялась реальності, і я боялась життя. Але я вирішила, що страх не має жодного сенсу. Можу сказати, що найкраще у тверезості – це жити справжнім життям.
Welcome back. For our next discussion, we are joined again by Professor Jürgen Remm, and welcome to the studio, Aaron Aragai. a public health intelligence officer in the WHO Health Emergencies Program at the WHO Regional Office for Europe. Welcome. Aaron, I would like to ask you the following question. So given the limited mental health and psychosocial support services in frontline areas, how do you think we can better address the self-medication trend through alcohol? And are there any other specific challenges that you see that need to be addressed?
Yeah, first, thank you very much for having me, Alexandra. And just for disclosure, even though now I'm with the regional office here, I've been with the Ukraine team working over 4 years with Jarno and the team there. And generally, I think it's good to set the scene first. I think we know that the war has devastated the entire country as we know it, but I think the impact on the specific areas, as we call them, the frontline areas, which are closer to the line of conflict, is devastated by this impact. And we can see from the different surveys we do together with the country office, for instance, the health needs assessment shows us 3 out of 4 households in those front areas have access issues. What it means is they face barriers when they access essential health services, and this is not different when it comes to mental health services as well. We also know that the attack on health, which has been very significantly very high in Ukraine, has also impacted the health facilities in those areas, and we know that close to 15% of the facilities are either fully or partially not functional. And this context makes it very difficult to get those services. And we know from the areas where Alisa has already mentioned that the services, the mental health services, are being provided, but I think this context makes it very difficult for those communities that are living in those frontline areas. So I think when we look into the impact, we expect that the consumption of alcohol and the consequences might be much higher in those front area compared to the rest part of the countries. And the other aspect, which I think was highlighted both by Andre and the other presenters, is I want to highlight 2 things. One is the trend of using alcohol or the consumption of alcohol in households compared to outside settings, plus the fact that the prohibition of alcohol in those frontline areas makes it people to shift into more home-brewed alcohols, and that is more prevalent in alcohol poisoning. We saw it in some of the numbers, and I think 48% of the reported in the study consume this kind of homemade alcohol, and that makes it more, I would say, the alcohol poisoning incidence has significantly increased over the month. So I think in totality, we know the significant challenge ahead in the country, in Ukraine, but beyond that, I think there should be a focus given to these frontline areas where there are several layers of challenge on the services overall in the country.
Thank you so much, Aaron. And I think that's very interesting, and also a very interesting observation about the home-produced alcohol and the challenges of that. Jürgen, maybe you can reflect a little bit on that as well. Is this something that we see in general with restrictions on alcohol, or is it something that is sometimes seen in crisis, or could this be a frontline area specific, like really devastating crisis observation? What would you say?
In general, what we see is that in times of crisis, people concentrate on the main responses. The police doesn't have that much time or willingness to go into unrecorded consumption, which has been relatively prevalent in those areas. So it's seen as part of the communal makeup. So what could be done, however, is, and we see that with unrecorded consumption in other countries, that we strengthen the families and the communities to make them aware of the problem. What we saw in those surveys is that suddenly the number of people who were seen as having an alcohol use disorder problem or an alcohol problem increased quite dramatically within 1 year. That means there is concern in the family, and that concern can be used to strengthen communities overall. And that's a much more likely response than going into the formal route and saying crack down on unrecorded, which usually doesn't result in a lot.
Yeah, thanks a lot. And I think except for the frontline areas, Aaron, maybe you could tell me if you have seen any observations of also some healthy, positive coping strategies and in communities among the people. Is there something you can name there as well?
Yeah, I think that there's very encouraging trends as well. I would mention, for instance, few instances where I had the opportunity to be part, where there are several kind of youngsters organizing these cultural events or music events where you don't see a lot of these substances, whether alcohol or others. And it was quite refreshing in places like Kharkiv, for instance. They organize these events of music festivals and show where they promote more healthy kind of lifestyle. And me, myself, I'm a runner, long distance runner. We used to go out also have running kind of sessions with few youngsters in Kharkiv and places like that. So it's not only doom and gloom, I would say, especially in those places, to see people out and running, and also all these cultural events. So I think we need to kind of find those spaces and kind of encourage them and promote them to promote those lifestyle, I would say. So it's a mix, I would say.
Perfect. Thank you so much. I think that's very encouraging and actually bridges perfectly into the final session of our event today, where we'll talk about youth, alcohol, and recovery. And for this, I'm pleased to welcome Dmytro Stolarenko, early career researcher in the Evid Action Network, and Vladislav Pronoza, Evid Action Alcohol Youth Network member. Vladislav, I'd like to start by asking you, from your perspective as a young man living through the full-scale war, how have you seen people your age coping with stress and uncertainty, and any reflections about alcohol use among youth?
Good afternoon, everyone. Alexandra, thank you so much for having me. I probably should mention that I also work with Valeria Hrytsenko at the same department at the Public Health Center of the Ministry of Health of Ukraine. But today I would like to cover some my own empiric data, right? Not based on the one that science provides, and therefore this is my personal observation, and I should probably start. So from what I've observed as a young person living in wartime Ukraine, coping strategies among youth, they are highly diverse and they are increasingly polarized these days, definitely. And many young people have turned to constructive coping mechanisms. I know many, such as volunteering, right? It's civil engagement, it's sports, it's mental health support tools like journaling or other therapies, right? And this action often reflects to a common sense of responsibility and the need for stability, even though there is some sort of chaos going on, right? But however, at the same time, a significant share of youth rely on some other sort of coping, right? This is like alcohol consumption, and alcohol plays like a big role here. For example, we've seen that Mr. Andriy Skripalsky has provided us with some information that that there has been an increase in heavy episodic drinking among 18 to 29 years old people, and 67%, right, they reported they also reported at least one episode of binge drinking in 2024. And also at the same time, we have some reliable data from the European School Survey on youth, and I'm talking about school children, right? So that there have been a decrease in Ukraine. So meaning that some interventions, they tend to be quite good, quite reliable, even though there is a wartime in Ukraine. So it's very controversial. Okay, so in some informal conversation, I've often heard peers describe drinking not as a recreation, but rather like to kind of mute emotions. Okay, it's just to fall asleep faster, just to numb the tension. And over time, this can escalate risks, right, for dependency and basically deteriorate mental health. So while there is resilience is present, so is vulnerability, and how young people cope depends heavily on the access to support, community, and sense of meaning during crisis. Okay, thank you.
Thank you so much, Vladislav. I think that was really great to hear, and absolutely it's diverse, and you even said it's polarized, so exactly as we've been hearing from other colleagues as well. And Dmytro, I would like to ask you, as a young health professional who has worked in public health and in humanitarian response, what have you seen as the biggest challenge for health workers when it comes to helping people with mental health and alcohol-related problems during the war? And yeah, what are some of your observations?
Thank you, colleagues. Happy to be here with you and happy to share maybe some of my insights that I had during several few years working in the field. So for me, when we're talking about the challenges among health workers, the main challenge that is also communicated by the health workers themselves is that the problem of alcohol consumption and the wider context of public health, it is always connected to even wider context of where we are economically, where we are politically, where we are in humanitarian sense, and so on. So when we're talking about, for example, some kind of interventions to reduce alcohol consumptions as the solely a public health problem, we get into the field when we need to ask and answer the questions about what are the real alternatives that can be offered to the people who decided to quit alcohol. What are the activities and what are the economic resources that we have that we can provide to the communities to organize such kind of events that, for example, Aaron mentioned. What is the economic impact of this change in terms of switching from consuming alcohol as a social activity to consuming alcohol as a coping mechanism and mode to reduce the psychological tension? And what is the economical source for the sustainability of the community? Because if the community as a whole, as some kind of unit, economical unit, if it's depressed, if it has difficulties sustaining its existence, of course, it's very hard to talk about the problem of alcohol itself. And of course, the health workers themselves, they are part of this community. They suffer from the same problems and they are using the same coping mechanism. They try to develop their own resilience with the things that are available for them. And therefore, I think we maybe at some point we underestimate the level of the overlapping of different kinds of problems in public health field, in humanitarian field, in the field of economical policy, and so on. So I think if we're talking about how we can help health workers to build the resilience themselves, to deliver services more efficiently, to help people who are seeing alcohol as their problem, is to answer how we can build the resilience of the communities in the wide context of all these different aspects. So it can vary from, I don't know, developing the livelihoods component of humanitarian response to some kind of cultural and communicational programs, and developing the capacity of the communities to be self-governed, to be economically fulfilling for their members, and so on. So at this point, I think that it's very hard to think of the problems of the health workers in such kind of contexts. It's always a wider question that requires cross-cutting action, and I think that the platform that has been established by WHO is a very, very productive initiative to bring the professionals together just to discuss such kind of things, and I'm happy to be here with you. Thank you.
Thank you so much, Dmitro, and we're also really happy to have you in the network and part of the project. Thank you so much for your perspectives, and we've heard so many perspectives and angles to the topic of polarization of alcohol consumption during crisis today, and also some very striking examples from the Ukraine context. I would like to give the word over really briefly now, one last time, to Andriy Skipalski for a really brief wrap-up, because we're slightly over time. Andriy, please summarize today's discussions and let us know what stood out for you.
Alex, thank you very much. And thank you for active participation, for insights, and for questions and answers all present here. And I would like to summarize that we all here understand that Ukraine is going through extraordinary challenges, war and humanitarian crisis. And the resilience of my countrymates is incredible and remarkable. We observe that coping strategies include both drinking less and drinking more in some groups. And that's why we call it polarization, this webinar, polarization of alcohol consumption. And this definitely, the situation would increase the burden on healthcare, as we still have 57% of active drinkers, which is an increase during 1 year by 12%. We observe increase in heavy episodic drinking by 10%, and these are very alarming tendencies. We've heard that there are many comprehensive programs like MHCAP program, which is rolling out and is part of Ukrainian healthcare system with a huge army of primary healthcare doctors trained already. And they address as far as they can the alcohol disorders and other substance use in population during their everyday work. But I think more and more is needed to be done to be ready to address this problem in a more comprehensive way in the coming years of recovery. I think what is important is to collaborate with mental health team and with all the partners on joint actions. And there are 2 documents now in Ministry of Health that demonstrate the priority in this area, which is National Action Plan on Alcohol and Comprehensive Strategy of Substance Use and Abuse in Process. So it's a great hope that these documents will shape the political will, because for some of the quick buys that I shared with you, colleagues, and best buys in alcohol, political will and leadership in this area is very, very important. Without this, only the healthcare system is not capable of coping with this threat. And at this point, I would like to sum up and thank you again on behalf of Country Office in Ukraine, WHO Country Office in Ukraine, and to all my colleagues present here for their contributions, and regional office colleagues for organizing this event. Thank you.
Thank you so much, Andriy, and thank you to all our speakers and participants for being part of today's important conversation. We hope that the evidence and stories shared today inspire reflection, collaboration, and action, especially in contexts of crisis. To stay updated on future events, findings, and campaigns, we invite you to follow the EVID Action Project, the WHO Regional Office for Europe, and the Country Office in Ukraine through our websites. Together, we can redefine our approach to alcohol and build healthier, more resilient societies. Thank you.